Well, welcome back. Time for our Fox 4 House Call with Dr. Andy. And this morning we're talking about childhood seizures. Seizures in the news a lot with John Roberts, of course, the Supreme Court Justice, having his little episode. But these seizures are child ones that hopefully kids grow out of.
Right. Commonly called febrile seizures. And by definition, they occur in kids between 6 months and 5 years of age, and they occur when kids are sick. They have a fever.
So is there anything that definitely defines a febrile seizure? How do you know that it's this type of seizure?
Well, it's a convulsion or a seizure, usually typical to what people think of when they see a seizure on a television show, when the whole body will tighten up, tense up, maybe the child will become unresponsive, maybe shaking, maybe not. And it's usually associated with another type of infection or illness, and they will have a fever of different degrees, some very high, some just a medium fever.
Are these seizures dangerous? How long should they last? What do you do?
Right, no, that's a good question. It is extraordinarily frightening for parents. And so the hardest thing to do is the first thing to do, which is to calm down and stay calm. Usually we tell parents to call 911 only if it's been going on for more than 10 minutes.
10 minutes, wow.
Exactly. So the things that you don't want to do, you don't want to put anything in the child's mouth.
Okay.
Forget about everything you've seen on TV. No bite blocks or anything. Don't try to restrain the child. Actually just lay the child down in a safe place where they're not going to bump anything. Watch the clock because you want to know how long it lasts for, and stay with your child.
And they should just come out of this on their own?
Almost always. These resolve on their own within a few minutes to a few seconds sometimes. Again, by 10 minutes, it's almost always stopped, at which point definitely call for help.
Right, if it hasn't. Now, is there a concern that if they have these child seizures, they're going to develop epilepsy or another condition later in life?
There are very strong concerns. Parents are always worried about that. Is this epilepsy? The answer is absolutely not. And the risks of developing epilepsy are only about 2 to 4%. So they have a very good chance of living a completely normal life. And with that said, many kids will have a second or even a third seizure, but usually by 5 or 6 years of age, they've grown out of it.
Is this pretty common to happen in kids?
It is. Actually, it's very frightening. About 1% of all kids will have a febrile seizure of one kind or another in their childhood.
So could they just have one, or if you have more than one, you're definitely going to have others?
No, most have just one, and about a third will have a second one. And then of that group, about half of them will go on to have a third.
Okay, so you get your kid through the actual seizure. It didn't last the 10 minutes and stuff. Should you still take him to the doctor?
You definitely call your doctor. I always tell people, definitely call your doctor. And the search then becomes not why did they have a seizure, but why did they have a fever.
All right. Lots of good information for you. And if you have any questions, you can get a hold of Dr. Andy by giving him a call, 694-6246, or Dr. AOL at phc-md.com. Dr. Andy, thanks so much.